In what ways does menopause add to the complexity of pain management for women veterans who are experiencing both comorbid pain and menopause?
So we know from research that women veterans are at higher risk for multiple pain diagnoses and also at risk for, I'll call it risky opioid prescribing, long-term opioid prescribing, and also an increased risk for mental health conditions. And that seems to be affected by their experience of menopause symptoms. The greater the symptom burden seems to be an issue, as well as their veteran status and some of the things that come along, some of the conditions that may come along with veteran status, such as PTSD or MST, which is military sexual trauma.
What makes acupuncture a beneficial treatment consideration for that particular patient population?
Oh, that's an interesting question. So it kind of depends on how you're using the acupuncture. What are you treating exactly, and what kind of techniques you're using? Acupuncture can be very calming. It does work with your central nervous system. So if you are treating to, let's say, anxiety or PTSD, you might choose a certain type of acupuncture treatment, and that can be very helpful for veterans who are experiencing, let's say, chronic PTSD. Or you might be treating them for pain and, let's say, their menopause. And what it does is it helps them have options that are not pharmacologically based. It's a conservative measure that's very safe and that has shown to have good benefit with both pain and also for menopause. And I think because of the different ways we approach treatment with acupuncture, we can also meet them where they are. Some of them do have some hesitancy about just medical treatment because of their military history or other personal history. So we can create an environment that's, I'll say, fairly low impact, maybe taking into account how they feel about having a medical provider close to them in an enclosed kind of clinical space. And luckily with acupuncture, we're able to work with that.
Can acupuncture be used in conjunction with other therapies such as pharmacological options?
Absolutely. I work on an integrative pain service, and when we look at something that we call stepped care, right, and we're evaluating somebody who's coming in for their low back pain or their migraine or multiple pain diagnoses in the setting of sometimes rather complex medical histories, we always want to start, as with any discipline, with conservative measures, the least resource intensive, the least burden on the patient mentally and physically. And as we look at their stepped care, acupuncture is often a really good first step for them. Even though our patients are generally coming to us with chronic pain and they've tried many, different treatment options before, acupuncture is safe. It's also very calming for them. And so once they're coming into acupuncture, we would then make sure that they're also getting some of the other conservative measures that work well in conjunction, like physical therapy or pain psychology treatments to help them manage other aspects of their chronic pain that are very important not to leave out. And then during that process, we may also be referring them or have already seen the referrals coming in for their diet and nutrition or their exercise, and as I mentioned, physical therapy, but also do they need to see, physiatry or neurology or anesthesiology? So multimodal care can be very much, let's say, enhanced by using conservative measures that address various aspects of their treatment and is not contraindicated for the most part with other treatments. Maybe a few things that you would be, concerned about, but overall, it's safe to use in conjunction and useful to use. And with multimodal care also, you don't always want to just, try one thing and then wait 8 weeks and then try another thing. Some things really do work well in conjunction, and it's safe for the patient to proceed.
Are there certain comorbid conditions that may cause a patient not to be a suitable candidate for acupuncture?
That's a great question. Because it's so safe, sometimes there's an assumption that it's great for everybody all the time. And sometimes it depends on the type of clinic that they're in. So let's say a patient is coming for pain management, but they also have perhaps unmanaged PTSD. Okay, then that person might not be a candidate for some types of clinics, perhaps like in a group setting. They're not comfortable in there, and their trauma is not well managed. That's not a good match for them, at least not at the time. Other comorbid conditions, let's say there's pain management for a particular condition, but the patient maybe is coming in for managing the side effects of their cancer treatments. And you would be looking at whether or not, let's say, their platelets are too low. You need to look at their ANC, and that patient might have to wait and have acupuncture in between their therapies. Or it's a consideration like conversation with the oncologist for safety. I don't think there's any, infectious diseases, always an issue that we have to be aware of in the clinical environment and for the safety of our patient. And then sometimes it's just really about your, the type of clinic, the type of technique you're using, if it's appropriate for a particular patient.